L4, L5 disc bulge, L5S1 disc bulge. What do I do about it when my MRI tells me that I have an L4, L5 disc bulge or an L5S1 disc bulge? That's one of the most common questions I've been getting right here under my videos in the comments below. So in this video, I'm going to give you 4 exercises that you can do to help relieve any pain associated with disc bulges in your lower lumbar spine, your low back, either at L4, L5 or L5S1. So follow me and I'll show you some of these tips right now. Helping you relieve pain, conquer stress, and supercharge your health the chiropractic way. So in this video, not only am I going to show you these exercises to help relieve pain associated with disc bulges, whether it's low back pain, gluteal buttock pain, or leg pain, I want to actually show you some of the anatomy associated with disc bulges. So here's a spine, okay? Here's a spine, the white blocks here, these are the bones, okay? The spaces in between, these cartilaginous spaces, these are the discs. They act like shock absorbers when they're healthy. When they're injured, they could bulge. All right, so here's an example, this red one here, that's an example of a disc bulge. If that disc bulge actually goes back and hits this nerve over here, you see that nerve? So if it hits that nerve right there, that will cause radiating pain into the leg. That nerve could contribute pain all the way down to the thigh, into the knee, into the calf. If it's the lower nerves over here, these ones here may even go down to the foot, to these nerves. They'll radiate pain into the foot. So a disc, when it's injured, can actually have inflammation in its local area at the disc region, and that in of itself will cause local pain. But when that bulge actually hits a nerve, whether it's inside the spinal canal or at the lateral aspect here where the nerve comes out, that nerve can radiate pain into the leg. So let me show you a bit more of the anatomy, and then I'll go over and show you these 4 stretches and exercises you can do to help relieve any pain associated with disc bulges in either L4, L5 or L5S1 lower lumbar, low back region. So follow me and take a look at some of the anatomy a bit further. So here's a spinal chart from the Anatomical Chart Company. And I want to show you, again, some of the structures associated with disc bulges. So here's a normal spine, okay? So nice curves on the lateral aspect. Very, very important. Here's L4 vertebra, L5 vertebra. That's the L4, L5 disc. L5 vertebra, this is the sacrum. That's the L5, right here, L5S1 disc. Here are the spinal nerves. So you'll see that the discs actually absorb. So that's a normal disc. When you put weight or load, they act like shock absorbers when they're healthy. But when they're injured, so here's an example of a herniated disc again, it can actually touch that nerve. That nerve can cause local pain. The disc can cause local pain, but it can also refer pain down these nerves that go into the legs, into the lower glute and buttock area, and the thigh, and cause sciatic type pain. So that's an example of a disc bulge right there. And let me show you a bit more of the anatomy here, because people ask me about their MRI reports. So here's a cross-section of the spine. So over here is the back part of the spine. Over here is the front part. That's the vertebral body. That's an actual disc. So it's showing half the disc. So it's showing the bone, the vertebral body, and the disc. And then here's a spinal cord inside the spinal canal. Over here is called the dura mater, and the dura mater makes up the thecal sac. If you hear compression onto the thecal sac, that means that the disc is pushing back towards this protective sac. Inside here is a fluid, and of course if it touches far enough, it'll touch the spinal cord and cause spinal canal stenosis and injury to the spinal cord, and even further damage to organ systems and referral pain. If a disc goes lateral, it will actually hit the lateral recess. If you hear neuroforaminal stenosis or lateral recess stenosis, that disc is actually herniating laterally over here, and this nerve actually emerges on the side of the spine. It can cause, again, radiating referral pain into the glutes and into the legs. So there's some anatomy to help you understand what's happening with lower lumbar L4, L5 discs, L5S1 discs, and to get an understanding of your MRI report. So let me show you these exercises. So I hope you found that lesson on anatomy useful. Very, very basic lesson. Give you an understanding of the lower lumbar spine anatomy, how it relates to your particular low back disc bulge condition. And if you happen to read your MRI results, what the MRI results are telling you, basically, you can relate to the anatomy. So let me show you what these exercises are that could help give you relief for your associated pain associated with L4, L5, or L5S1 disc bulge. And I'm just going to use this bed over here, this table here, and I'll show you these exercises, okay? There'll be 4 exercises you're gonna learn, so pay attention and check them out. Okay, let's get started. This is exercise number 1 of 4. It's called Mad Cat or Angry Cat. stretch, or exercise. These are pelvic tilt coordination exercises. Arch your back to get a backwards pelvic tilt. Sag your belly to get a forward pelvic tilt. Arch your back to get a backwards pelvic tilt. Sag your belly to get a forward pelvic tilt. Do these rhythmically 10, 20, 30 times. Very effective in mobilizing the lower lumbar joints, the lower lumbar discs, L4, L5, L5S1. More mobility means more fluid being drawn into the discs. More hydration into the discs means more health. And the motion also relieves pressure in these discs and also any tension associated with disc injuries or low back inflammation and injuries. Exercise number 2 of 4, it's a seated version of these pelvic tilts. Sit at the edge of your chair and you're going to jut your belly forward for a forward pelvic tilt, round your back for a backwards pelvic tilt. Very rhythmic, coordinated movements. Jut your belly forward for a forward pelvic tilt and then round your back for a backwards pelvic tilt. The seated version of these pelvic tilts a little bit easier than the Mad Cat version. Always do these exercises within your pain tolerance. Exercise number 3 of 4. These are knee to chest stretches, helps relieve muscular tension in the gluteal region, the buttocks, also the low back region, and also relieves pressure and tension in the nerves that are associated with leg pain and sciatic pain. So you pull your knees towards your body, hold that for 10 seconds, repeat it 3 times. Again, always do this within your tolerance. Never stretch or do exercises that triggers or aggravates pain. There's a single knee to chest stretch. 3 times you do it on each leg and hold that for 10 seconds. And then there's an angled version, good stretch for the gluteal region and also low back region. Very, very effective in relieving tension in the lower back and also in the nerves that go into the legs. Exercise number 4 of 4. This is an extension Mackenzie protocol exercise, helps relieve pressure in the lumbar discs. You lie flat and you lift your body, your chest off the ground. Keep your elbows flat though. Do not lift your elbows up. This is the easier version. Helps relieve pressure by gapping up the spaces between the vertebrae where the discs are. This is the more challenging version, more advanced version. It's an extension exercise, helps relieve pressure in the lower lumbar region. You extend your arms out to get a better, bigger extension. There you have it. I hope you found that useful. And if you have any questions, please leave them in the comments below. And if you found this valuable, share it with a family member or a friend. Make sure you click the subscribe button so you get updates on new videos. And also, I'm always looking for suggestions on content. If there's any particular videos or questions that you want me to answer on video, just post them in the comments below and I'll make some video about that. And just so you know that you're getting the notifications when new videos are coming up, click on that bell button so you're turning the notification on as well. Dr. Walter Salubro here, chiropractor in Vaughan at Back to Health Chiropractic Center, signing out, and I'll see you on the next video. To learn more about how corrective chiropractic care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.